Welcome back to another episode of Thinking Critically. Today I'm joined by Dr. Jay Baruch, who is a professor of emergency medicine at Alpert Medical School of Brown University, where he serves as the director of the Medical Humanities and Bioethics Scholarly Concentration. He's a practicing emergency physician, writer, medical educator, and accidental academic whose interdisciplinary work evolved in response to medicine's unaddressed messiness, which requires creativity as a clinical skill, and physicians who think like creative writers and artists. He's the author of two award-winning short fiction collections, What's Left Out and 14 Stories, Doctors, Patients, and Other Strangers. Most recently is authored Tornado of Life, A Doctor's Journey Through Constraints and Creativity in the ER, which is what we'll be discussing today. Anyway, Jay, welcome so much.
Hey, thank you so much. It's great to be here.
Yeah, absolutely. It's wonderful to have you. And I can say that I'm excited to dig into your book today because I read it obviously in preparation for this discussion, and I absolutely loved it, and I particularly enjoyed the writing style. But before we get into that, I'm always curious whenever I have any sort of scientist or doctor or just interesting individual on in general, how it is that they became interested in what it is that they're doing. So in your case, science and medicine, where does that all come from for you?
Uh, but for me, I, I actually, I am foremost a English humanities nerd who
Okay.
managed to incorporate the necessary sciences to do the work that I do. I've always been geared towards writing and the humanities. I went to college to be an English professor, to be a writer, hoping to be. Loved love stories, had revered writers and artists, and I became interested in medicine from I had a couple of experiences in college that brought me into conversations with patients and really meaningful conversations, and being totally enraptured by that and those encounters, and not only by the privilege of being exposed and being the witness and being on the receiving end of such profound experiences that people were going through, but also realizing that, in medicine, I actually have a chance to act on those stories. I can have the knowledge and the experience and the training, and I can. And that was really my entrance way into medicine. I was as a science using artist, rather than someone who was primarily geared towards the sciences and then went into medicine. So it was sort of, I kind of slipped in through the humanities door, so to speak, John.
Yeah, that's really interesting. I mean, I've done a number of these, and I've never heard of anyone who has done quite that journey. I did have someone on recently who was interested in also writing like an English major, and then ended up going into mathematics. But
Right.
mathematics isn't quite the same as like going for medicine or where particularly emergency medicine in your case. But the I can definitely tell from this book that you've written that you've written fiction in the past, just because the narratives were absolutely wonderful. So I really loved the way that you kind of weaved your experiences into these stories. And I think it's something that you allude to in the book, and maybe you overtly state it, is that people do gravitate towards stories, towards these narratives. And I particularly really enjoyed that.
Yeah, I think it's really interesting that you recognize that, and I really appreciate that, because oftentimes I find that in several books written by physicians, even books that these are books that I love and revere. Oftentimes the narrative element, the situation being written about, is really sort of an occasion to then sort of really to go off into the ideas, or to go into the policy, or to go into the science, and and I understand that, and that's like really good. That's really good narrative writing. But my focus really is on the people and on the story itself, um, and I feel like that different perspective on it is not necessarily about writing a a better book or a different book. It's just about, I think, how we bring our own sensibilities to the work that we do, right? And I think that's what makes it so fascinating, not just in medicine, but in even the person you interviewed about mathematics, right? They bring their own perspectives into their work, and hopefully, if we're lucky, we get a chance to either teach or to express that and share it with others, and hopefully it resonates with people.
Yeah, no, I I definitely think that the narrative really resonates with people, and I know that you had mentioned about other physicians writing books, and I know I've written one book in the past too, and obviously as a scientist myself, I've written a lot of textbooks, and I know that, and this goes back to the book that I've written myself. It is informative, but almost a little dry in the sense that you're kind of just stating facts and how these facts loosely connect with the real world. But when you create these narratives, and I've written books in more dense subjects such as, let's say, medicine for you, or even in philosophy and logic, as another example, or critical thinking. And when these narrative styles are implemented and you tell these stories, I don't know, there's just a whole nother level of appeal, in my opinion. And I definitely know that I'm trying to do that in my own writing because,
Right.
like you, I'm a fan of writing. And I
Yeah.
just think that it's so important. It really helps to connect with people who may not necessarily be interested in the subject material to begin with, but what person doesn't love a good story?
Exactly. And I
Yeah.
feel there's hopefully, and what all good stories share is uh a captivating or an interesting or provocative protagonist, someone who is striving, who has desires, has needs, has striving for something, and then obstacles get in their way, right? So even if the obstacles in, let's just say in medicine, let's say the obstacles are, the body has gone awry in some way, whether it's through the disease or injury or um how we're always interested in how we're meeting those obstacles, right? Because even if that's not something that we are experiencing exactly, we're always fascinated by how we deal with trouble, how we respond to trouble, like how we cope with it, how we understand it, and how we try to deal with it and move on. And those are really deep human questions. Regardless of the situation, they oftentimes resonate with us in profound ways because we can see the connections to our own lives.
Yeah, no, absolutely. Yeah, I mean, like we I just said earlier, who doesn't love a good story? Because
Right.
it definitely connects with you. And if you can take complex material and weave it into this beautiful story, uh, there is a far better chance, I think, of the average person latching onto it, maybe even absorbing some of it. So I just think it's brilliant. And I definitely know that, I've seen it a few other times too with more complicated or complex material. And I definitely want to try to do some of that more myself in the future.
Yeah, I don't know who said this. I didn't. It's drawing a blank, and it's not a exact quote. It's not nearly as eloquent as it should be. But something about like what a story is often, it's like facts and events wrapped in emotion,
Hmm.
and that element of what the experience of going through something, and how do you convey that and in a way that is sort of vivid and concrete and expresses the complexity of it. I think that is really where the challenge is and where the fun is.
Yeah, absolutely. So anyway, you started off in English, humanities, and
Yes,
then you kind of
yes.
found your way moving into medicine. And at what point did you decide that you wanted to become an emergency doctor, or that you wanted to do emergency medicine? So there's so many different paths that you can go down in medicine. Why
Yeah,
emergency medicine?
I know. Isn't that amazing? And it probably, in some ways, it's so. And I'm like close to doing this for 30 years, um, and in many ways, it's so antithetical to my personality. In some ways, it's so perfectly aligned with my personality. So I actually went to medical school, and I hope planning on figuring out being a psychiatrist, because it was very narratively and story oriented, and there were certain sort of physician writers who I admired so much who were psychiatrists, like Robert Coles, for example. Um, and and then I went into and I was preparing to go into psychiatry, and I did an elective in emergency medicine. And I don't know, like at the time, this is even before the show ER, and I got like I'm old as dirt. This is like right before the show ER came out. Not many people knew what emergency medicine was. We didn't have the reality TV shows that we now have, and so it was sort of like there's this mystique around it, and I got to tell you, like there was something about the social justice mission about emergency medicine, which was and is the fact that we care for people that oftentimes people for populations and communities that can't get care elsewhere. They come to the emergency department. The fact that we serve as like the safety net in the healthcare system. Um, but also there was a sense of sort of getting a chance to just meet so many different types of people in that work, and you saw everyone who came into the door, and I found that so compelling and fascinating. And then for some reason, like being in that space and not knowing what's going to walk through the door was both terrifying and invigorating at the same time. And for some reason, it just felt like home when I started doing like rotations there. And you make your list. You make your list of like, what are the things that I like about a particular specialty, and what are the things I don't like or I want to avoid. And you write this list, and you try to be talk about critical thinking, right? You try to like be very logical about the whole thing. But then sometimes you just go into a space and you go, oh my God, this feels like home, like intuition. This feels like I belong here. And then it defies all logic and all explanation. And that was ultimately the reason why I went into it, because I just found myself really finding that space, a meaningful space to practice medicine in.
Very interesting. Psychiatry. So you started off with psychiatry and then you went
And
and
I still love
just did,
psychiatry.
yeah.
I still love psychiatry. And unfortunately, unfortunately, like we see tons of psychiatric and patients with mental illness, and people
Yeah.
with either diagnosed or undiagnosed, or people going through emotional, struggles in the emergency department, because of the fact that the mental health system in our country is so needs to be bigger, needs to be stronger, needs to be better than it is.
Yeah, no, definitely. And it is, you're talking about you're seeing a lot of psychiatric individuals in the ER. That's it's very sad. I mean, it shouldn't really be that way. People having to go to the emergency room, having mental health crises
Right,
when there should be systems in place that help them. And that seems to be a conversation I hear quite frequently. And
right.
it's been ongoing for years about improving the mental health infrastructure in this country.
Yeah.
So
And yeah.
hopefully it's something people are working. People are working on it, but a little bit more needs to be done here.
Yeah, I think, and the people and people who are working in the mental health field are, extraordinary, but this we need more. We need more. We need more infrastructure. We need more people doing it, because especially since the pandemic, we've seen a really increase in the number of people who are experiencing mental health challenges.
No, absolutely. I definitely think that the pandemic, to a degree, and I'm not sure how you feel about this, but we had to do the lockdowns and all of that in the beginning of it, and it seemed as though certain individuals who suffered from particular types of mental health illnesses, it made it worse. The lockdowns, unfortunately. So we had all of these different ways that we had to deal with the pandemic, and it seemed like every time we tried to fix a certain aspect of the pandemic, whatever it was, suppressing community spread, et cetera. But then we had
Yeah.
these ancillary types of problems that popped up and that we
Right.
had to deal with on the back end of things. But
Right.
Yeah, we can get into that later. But yeah, it's just unfortunate. I know that definitely mental health was something that suffered or something that a lot of people had to cope with throughout the certain aspects of the pandemic, and
Right.
then it really exacerbated that.
Yeah. And I
But
know, and loneliness and the isolation and the
yeah,
loneliness was a big issue as well.
no, definitely, definitely. But anyway, okay, so you find yourself in emergency medicine. You're practicing for a number of years. You've written a few. You love writing. Written some wonderful fiction novels. Now, why did you feel like you needed to write this particular book, Tornado of Life? So the full title, so this you have a secondary title, A Doctor's Journey Through Constraints and Creativity in the ER, which I love, by the way.
Thank
But
you.
yes, I'm just curious as to, yeah, what was the impetus for all of this?
Uh, Again, like I think the the explanation might be dispiriting to many of your listeners, but like I didn't intend to write a book. I mean,
Okay.
I was my sort of my quasi, like I, as you said at the introduction, like I consider myself a reluctant or an accidental academic, and one of the areas that I've always been interested in is in the fact that in the role of sort of creativity and the constraints and how sort of arts based thinking really informs my own work in the clinical spaces. And I've written about, you know, how we need to think differently, and my own writing was in that area as well. And I don't just mean my academic writing, I mean, because like my I write, I mean, so when I work through, I think I write in order to think in a way I feel is meaningful and honest and transparent. I mean, it's amazing what happens when you put words on the page and you try to put words to an experience. Like you think you know an experience, you think you're processing an experience. And at least for me, I have to, when I write, and I get the hand moving, I access parts of my brain that that it just sort of kicks it up a little bit.
Mhm.
And so a lot of the book is really challenges that I was trying to work through on the page. I was trying to understand it for myself. And most of what I end up writing doesn't see the light of day because it
Mhm.
shouldn't. Um, uh, However, when certain situations arise again and again, or similar situations either arise to me or to others, and people say, God, you know, no one talks about this. No one talks about this. No one talks about this. Um, I then say, huh. And then I start revisiting, you know, some of these pieces. So there's always an underlying drive of necessity in almost everything that I write, especially the pieces in this book. They all emerge at a particular moments, not just experiences, but actually emotions that I was trying to process that ended up somehow coalescing into a book.
So that's really interesting what you said there about how you wrote it more or less for yourself, that it wasn't intended to be a book, and that it
Because
helps you to actually kind of like refine these experiences for you to try to figure them out, to work through them. Because I know that for me, this particularly like when it comes to learning new things, like I have to write it down. Like that
yeah,
really helps me to learn it. And I know that like if I'm trying to work through emotions or figure a situation out, like you said, that writing it down really actually helps to clarify it. There's something about like because you have to like think about all these other types of situations and scenarios, and it helps you to
right.
kind of refine the words, and then you think about the sentences after you put them down. You go through and you proofread it, and you think about the situation over and over again. I I do that myself, and I think it's fascinating that you kind of wrote an entire book based around this concept.
Well, it's also the way I just have always my entire life, even my the years ago, like my previous two short fiction collections all emerged from just experiences that somehow then got processed into fiction. This
Hmm.
just was just different. It got processed into nonfiction. And but I it's really interesting, right? Because like if you had gone through my notes and saw my notes, I mean, like they're sloppy and they're, meandering, but there's always something there that's interesting. There's always something that I did not discover before, that I didn't quite work out, or something that leads me to something else. Like it allows you to get very, very granular, and you're building something, and you're both going deeper, and you're building, and you're sort of going to these places that you wouldn't have gone before. I mean, some people, I don't know, Jonathan, like some people are just brilliant, right? And they have these brilliant ideas, and they put it on, and basically it's like, I'm just going to put it on paper. I got this brilliant stuff, and I'm going to put it on paper. I am not that person, and I get a chance to see my mind at work. Like we're talking about critical thinking, I get a chance to see my mind at work through the revising process. So as I revise, it's actually, it's not just revising the writing. Revision through writing is actually a revision of my thinking, and a sharpening and a tightening, and really, being crystal clear with what I'm thinking, and trying to get that on the page, and trying to close that gap as much as possible, trying to discover where I want to go, what I'm trying to say, what I'm feeling, find the language for that, and then trying to get whatever's up here onto the page, so that experience is somewhat resembles each other. You come close, and never is exactly gets that way, but that's what I aspire to do.
Yeah, very interesting. And I think it's actually kind of great advice for anyone who's watching or listening right now about, if you're thinking about something, start writing it down
Yep.
and then revising it, write it down again. And I think you'll be shocked or surprised about how much better you understand the situation that you did before after you performed the exercise.
And there's also literature to say that when you write about experiences, and you also couple that with sort of like the emotional journey that you were going through, or what you were feeling, so coupling like the description with the emotion, really, there's some beneficial effects to that. There's some scientific literature supporting that, whether it's helping with depression, helping with ideas like burnout, or but there's some really a growing body of literature on the role of sort of writing, and the health effects of doing that. I just find it helps to get it out, and to externalize it and see it on the page. It sort of frees me up. And also it sort of serves as a little bit of a as as almost like you're working through experiences, and it's almost like you're doing like you're playing through an experience. So if it happens again, you say, oh, I've been through that, I've worked through that, I think I know what I did last time, and what worked and what didn't, and how I could have approached this differently, and some insights that you might have otherwise did not have at the moment the previous time. And you can bring that. It's like a simulation. We talk about writing as reading as a simulation of experiences. As a reader, you sort of, or as a listener, you're sort of getting the simulation, the experiences of others, and incorporating that and learning from that. But I also think as a writer, you're also sort of creating your own simulation, that allows you to work through experiences moving forward.
No, I definitely agree. And I love what you said there about running these iterations in your mind. And I had the thought of, in science, the thought experiment, and how you're just essentially running something that intrigues you through the mind, through these processes over and over again. And maybe what scientists really should do is not just run the thought experiment, then put it down on paper as well. But I suppose maybe they both, that happens as well. But yeah, that just came to mind though, the thought experiment. I mean, that's a kind of perennial thing in science.
Right. Yep.
Yeah.
And I think it's fine.
So,
And I at least some of the colleagues that I know who do science, they do that too. Like they have I have my my dog, my one of my rescue dogs ate it, unfortunately, recently. But like they also have their notebooks,
Yeah, yeah.
and they're penning down ideas all the time. So I think there's a lot of similarities between the two projects of discovery.
No, absolutely. I definitely think that writing things down sparks curiosity and helps to refine ideas. But anyway, while we're on the topic of like writing styles really quick, I I found the writing style, besides the narrative style, I enjoyed the way that it was laid out, the book, like
Thank
from
you.
chapter to chapter, almost as it was a series of short stories. And I'm guessing that you deliberately laid it out this way. And I'm curious as to why you did that for the reader.
Yeah, so I didn't want to only write about an experience. I wanted to take the reader into an experience. Like I want them to sort of feel a little bit of the destabilization that we experience when we go from patient to patient to patient to patient, and the different types of stories that we encounter. Um, Many times most of the pieces are short because, as I said earlier, Jonathan, like I was writing basically out of just trying to process experiences, so I didn't have more information to work with. Like this is the information I had, and it usually had to do with these high profile moments to me, like these really troubling, difficult to understand moments that I was trying to process. And so I wanted to take the reader through that. And so we organize it. And at some point, we actually initially I started initially writing the book to talk about process. They were longer. We experimented with longer chapters and it lost its punch and it became sort of a little bit more academic-y. It became more I was explaining a lot. And as someone who comes from a world that's really rooted in narrative and telling and trying to engage with people on an emotional level, we didn't want to take that away. We didn't want to lose, what my editor, Bob Pryor said, like he didn't want to lose that punch, that
Hmm.
sense of, and so that's why everything it got shorter, and I want the reader to feel that, like, okay, I'm going from one intense experience to another intense experience, and some of the pieces are what quote unquote chapters are a paragraph long. Some of them
Yep.
are much longer. But that type of variety was very, very intentional.
I thought it really made it fun. And I like in my mind, obviously when you read a book, you have visualizations of kind of what's going on and what it might look like. And even for the really short chapters, it was, like just like a vignette, like a movie vignette playing in your mind. And I think you had like a short chapter on like catheters or something like that. And it was only like a paragraph and a half or two paragraphs long. And I'm like, okay, that was kind of fun.
Yeah. And it's also thank you. First of all, thank you for that because I'm very lucky that that my editor and MIT Press let me write this type of book. And part of it comes from my world of writing where we try to say what can I bring that's new to this experience? So, and I feel like what I wanted to push back against is I feel like when there's so many just fantastic, wonderful books by physician writers, and 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 they're deeply rooted in sort of policy, or they're very sort of more memoirish oriented, but I can't write those types of books, for many different reasons that probably belong to a different conversation. However, there was a certain type of book that I feel like I can write given my experience. And part of it of the role of sort of I think the arts in general is to sort of destabilize our expectations. And that sort of comes through in the book a bit, like people and I write about it, like you expect this to happen, and this is actually really what's going on, or I was
Hmm.
thinking this, and this is how I was wrong. Um, and how do you destabilize the reader's experience, and how do you sort of share this sense of trying to struggle and make sense of an experience, not necessarily as an expert, but as someone who's maybe a little bit more expert at trying to understand in ways that he's not an expert, and trying to process those really challenging experiences. And so I'm glad, like I was crossing my fingers because, hoping that the structure was going to connect with readers. And so it really warms my heart to hear what you had to say about that, and I'm glad.
Yeah, no, I definitely appreciate the artistic liberties that you took with how you structured the book. I thought it was fun. It made it more fun that way, in my
Thank you.
opinion. Yeah, absolutely. Okay, well, speaking of your book, let's go ahead and talk about and dig in a little bit more to the
Right.
content. So you have a book, or excuse me, you have a chapter on not knowing, and that
Yep.
medicine is full of uncertainty. And I just kind of want to explore this topic a little bit with you because uncertainty sometimes makes people uncomfortable. And how do you deal with that in the emergency room?
Yeah, it makes me uncomfortable. As I wrote
Yeah.
in that particular chapter, I think it sort of makes me the feeling I get from uncertainty is it ranges from like a mild allergic reaction to an outright panic attack, you know. Um, but what's interesting, Jonathan, is that in my training and when I finished medical school and my emergency medicine residency, all those things I thought were going to scare me, I was pretty prepared for it. Not like I wasn't terrified by it. And like whether someone came in a cardiac arrest or someone came in difficulty breathing or a bad trauma. But what I wasn't prepared for were these moments when I was didn't quite know what I was dealing with, where the story was sort of going in a bunch of different places, 1,000 different directions, or the patient wasn't really saying much, or things weren't lining up, or they had a bunch of complaints that weren't pointing to a diagnosis. And what do you do then? Like, what do you do when there isn't the answer, but you had to somehow come up with an answer and a
Mhm.
response, right? And so, I think that's what you find and it actually required me to sort of borrow from my other life as a writer, which was like when you're stuck, when I'm writing, when I'm stuck, you start interrogating why you're stuck. First you recognize, first you push through, push through, push through, then you realize you're knocking your head against the wall. But there's this feeling that you're not there. So the first thing I had to recognize when in the clinical space was like when I was getting that feeling. And that feeling was similar to when I had trouble moving forward in my writing. And then it's like, how do I borrow from, and I found myself borrowing from my writing skills, how to work with uncertainty, how to like recognize problems and to realize that what I need to do first is to actually step backward and find out, God, how did I get here? Who was this person? Like ask the same stories I would ask of characters when I was writing fiction at that time, of these fascinating, profound, compelling characters who I'm trying to care for, who are sitting on a stretcher before me or laying on a stretcher before me. And there was so much overlap. And so my writing, actually, my career as a writer and my evolution in my of craft as a writer grew with my evolution as and development as a writer. So how do I not just tolerate uncertainty, but actually how to use uncertainty, recognize it as an ally, as I write in the book, to say,
Mhm.
okay, how do I change my course? How do I change? How do I move from what is the answer to saying, am I asking the right questions? Should I be approaching this in a different way? Um, and so it's a different way of thinking through a particular moment.
It's very interesting how you kind of bring writing into the concept of uncertainty the in the emergency room. Yeah, I find that particularly fascinating, and also something that you mentioned there with just thinking in general, I should say, like how has your I guess working in the emergency room changed the way that I guess you think about the world in a sense? Like would you say that your thinking improved from years of working in the emergency room and learning how to triage and dealing with these uncertainties? Because I know like you have systems in place. You have these mental models that you've crafted through years of experience, and you have your training, your years of training. I'm just curious to hear like from you exactly how this has, I guess, changed your thinking over the years and like how you kind of approach problems, let's say, in the real world.
Oh, it's definitely changed how I approach it. I think it's changed how I approach how I live my life. It also has changed how I approach my writing and my more creative side. Um, One is the fact that, you get faced with stress all the time. Like there's this tons of people come in. Like I work in a very busy tertiary care trauma center, and so you're stressed all the time. Like there's always more things you need to do than the time that you have available.
Hmm.
So you got to get used to sort of identifying these feelings and working through these feelings and knowing how to process them and not let them get in the way. Because early in my career, you can feel overwhelmed pretty quickly. Um, you also, you learn to multitask. And when you multitask, on a high level and with the stakes are high, right? So sometimes when people point out, God, this was missed, and they isolate on a particular case, they don't always focus on the fact that we were caring for 15 or 16 other patients at the same time. It doesn't necessarily excuse it, but it doesn't. But the context in which decisions are being made is oftentimes lost when, in hindsight, when people try to dissect a particular case under a microscope as if nothing else is going on, as if it was the only thing we were doing that day. Uh, and then we're facing uncertainty all the time. Like the uncertainty isn't the occasional thing. Like the the moments that when people come in with a particular problem that is just straightforward and say, "Oh, I have the X, Y, and Z, and it equals this," is very rare. Um, and most likely, most of my practice is the practice of working through uncertainty. And and that can manifest itself on many different levels. Sometimes the medicine piece is straightforward, but then you have someone who is dealing with mental illness, or they have social issues, or they can't care for themselves, or they have housing insecurity, or they have substance use that interfere, or they don't have the money to get the antibiotics, or and on and on and on. And so you're always facing so many different challenges that are unexpected and that rear its head. And so how do you adapt to that? uh, and without sort of losing your sense of hope.
Hmm.
Uh, and then I think last is the fact that most people go to work, or they used to go to work. Now we meet on now we meet on Zoom, but they work, and most people have the good fortune of just when they engage in their lives, they see people at their best. They see people when they're dressed and scrubbed, and freshly washed, and for 30 years, I basically take care of people who are, if not at a worse moment in their lives, at a terrible moment of anxiety and fear and frustration um, and loss of control. And I see the parts of communities like, there are people. I live in Rhode Island. And there are I know I have close friends who have lived in Providence all their lives, and the Providence that I take care of is very different from the Providence that they live in.
Hmm.
And there's something that is both um, incredibly moving and profound about being a witness and having a chance to make an impact on people who are who are on the margins of our communities and deserve better. Um, but it also tests you in ways that perhaps other people are not tested. And so it goes on and on. But yes, I think working in the emergency department has I would not be the person that I am today if I hadn't worked in emergency medicine, and that can be good or bad depending
Yeah, right.
who you ask. I
Yeah.
think I've grown up. I'm still, I've been at it for close to 30 years, and I still consider myself a work in progress. Um, but I think I'm a more evolved human being than I was 30 years ago.
I really loved what you said there too about like the person-to-person contact, because that was something that all of us kind of lost to a large degree during the pandemic. And
Right,
yeah, there's definitely a need, I think, for most humans to be by other humans, and not just through something like this, through
right,
Zoom or through the internet, but like that close kind of personal connection. There's just really something, I would almost say
right,
like primal, like instinctual about that, like a strong desire for that as a human.
right. I
So,
agree.
but real quick, circling back to uncertainty, do you think that the average person in the emergency room, I think you opined about this briefly, or you commented about this briefly in your book, understands that whether it's a doctor or a scientist or somebody who is in charge, doesn't always have all the answers all the time? Like that there's always going to be a degree of uncertainty, or does this kind of make them uneasy and almost look at the you or whomever, let's say, you know, a person in charge, does it take away like their credibility in your experience?
That's a great question. And uh, so there are certain things that the public has expectations of, and they should, of physicians. So if you come into the emergency department and you're having crushing chest pain or shortness of breath, and you have symptoms either overt or more subtle symptoms of a heart attack, I should know enough to get an EKG. We should know how to identify and treat that and not miss a heart attack, right?
Yeah.
There are certain things we need to know. Like they expect us to know, and we're expected to be on point, like, and nail it. You come in with an overwhelming infection, we should be able to identify that. There are certain things that we need to get right, and that all our training goes to being alert to the many different ways of diseases can present, and and to make sure we don't miss the really bad ones. However, there's a lot of times people come in with, say, with chronic pain, or they come in with various different symptoms, for which we don't have a diagnosis. They come in with headaches or back pain, whatever. And my own experience has been that, you know, they don't want to be told that they don't, that, oh, you have nothing. This is nothing. Like your back pain.
Yeah.
Oh, this is nothing.
Yeah.
No, it's not nothing, because you've had enough. Your discomfort and your distress was enough that you left what you were doing to come to the emergency department, wait for hours, and be seen by a stranger, this knucklehead or somebody else, better looking and younger and smarter. Um, and and so it's not nothing. So I feel like what we need to be doing and what people appreciate in my own experience is like recognize the experience that they're going through and to validate their stories, right? And say, listen, I know this has to be hard. I know what you're going through. You have all this pain. I know they haven't found a reason for your abdominal pain, or let's say we do a bunch of studies, we don't find a reason and the reason to explain it at that particular moment, but we might have ruled out the bad stuff. And say, listen, this is what we've done. This is what we can do. We can control your pain. We can do some digging and try to find out what might be the cause, and at least start your evaluation or start the workup, and then move on. And then like have a plan for you for moving forward. You know,
Hmm.
I and I find that patients for the most part are so understanding. They just they just don't want to be blown off,
Yeah.
right? And they don't want to just be talked down to. They want to just have a conversation with another human being who's trying to understand their experience and doing their best to find an answer. And then if they can't, trying to give them some thoughts and some strategies and some help for moving forward. And and of course, there's the occasional outlier, but from my general experience is that there's some literature to support that those physicians who are more comfortable personally with uncertainty are more likely to discuss uncertainty with their patients in like shared decision making.
Well, I'm happy to hear that, because I know that uncertainty can, at least from my experience, and this may not reflect entirely what's in the literature, but and even from my own personal experience, I know that it can create uneasiness. At least before I suppose before I came more of a trained scientist and learned that we have to basically speak in probabilities because we really don't know everything with
Right,
absolute certainty at all times, and we don't
right.
have the answers for everything, which is why we do science and all of that. But I really enjoy what you said there too about when patients are confronted with uncertainty, as long as you connect with them and kind of give them some sort of game plan, it really helps them to feel better, that they don't want to be blown off. And I know that this is kind of a common theme that you talk about throughout your entire book. And there's another chapter there where you mentioned that like a lot of the patients they just come in and they suffer from the need of or want of warmth, food, shelter, security, and that sense of connection, and how important that is, that just interacting with another human who for whatever time that they're there makes them feel like they're cared about.
Yeah, and it's interesting, exactly. I agree. I think that was so well said. And also when we talk about, the podcast critical thinking, is that, you know, I, I also find that patients just welcome us thinking out loud about their situation. This is what I'm thinking. This is, I don't, what are your concerns? Often people will come in and say, listen, they don't necessarily want an answer or need an answer, but they might say, listen, I have this chest pain and I'm worried about a heart attack. Or like that's where you finally get out of them. Like when you chat with them, you find out that their father had a heart attack or their friend just had a heart attack and they have this twinge and you unlikely to be a heart attack, but they just want to be they come in for reassurance that
Yeah.
it's not something. But that just speaks to like just trying to understand, listen, what are your concerns? What are you worried about? And this is how I'm thinking through it. And what do you think? Like anything you need to add? And and I feel like we're doing better at that. And I know like in my the residency that I'm a part of and I'm faculty at, we're having so many of people I work with, physicians and mid-levels, PAs, and our residents or trainees are getting so much better at that. Um and and I- and I, and part of it is out of necessity because we don't always have the answer. But how do we somehow make it a meaningful experience and try to have these conversations with patients and be their advocate as much as we can when we don't know. And I think part of the problem, John, and like again, like this comes from, I don't know why it's like this, but in medicine, uncertainty also times carries this negative connotation, right? Like you don't know, like
Hmm.
we're supposed to know.
Yep.
And so it's hard to sort of to extricate the uncertainty from this negative connotation, and so this changes reframing of uncertainty as okay, yes, there are, if you don't know what you're supposed to know, if you're incompetent, like we're not talking about that. Like if you don't have a solid knowledge base, like that's a totally different issue. That's not saying, hey, I'm supposed to be uncertain. No, you have to have a certain level of professional knowledge. However, and meet those standards. However, a lot of the challenges that we face don't fit into neat boxes. Right? So how do you then can you think more creatively,
Hmm.
think more imaginatively, be more adaptive so you're able to sort of take that knowledge and also couple that with the experience of trying to understand what another human is going through.
Another thing too is that, even if you're one of the individuals where a doctor has to come to you and say, we've done all these diagnostics on you and it's all coming back normal, but you're like, well, I don't feel well, and then you come to me while saying, well, everything looks okay, you're not dying right now, because that's really what kind of happens, at least in your setting. You really want to make sure the person's
Right.
stable, so you
Right.
kind of rule all the bad stuff out. And then when you come back to an individual with the, well, I don't know what's wrong with you, we've done all these tests, everything looks okay for now. I think that it's really important for the person to kind of understand in that moment, while they don't have a definitive answer what's going on with them. They did all of these tests and they came back that you're okay. So you're going to be able to walk out of here, and then let's put together a game plan, like you had mentioned earlier, on the back end of it. Because I know it can be, for me, I got sick in college and I had to go see a bunch of different doctors, and it kept coming back that there was nothing wrong with me. And that can be a really frustrating journey for a lot of
Yeah,
patients. And like,
right.
and they're like, well, these doctors don't care about me. Nobody knows what's going on. They don't know what they're doing, et cetera, et cetera. And it's like, nothing could be further from the truth. I mean, maybe some doctors, maybe are a bit more callous than others, but I think in general, the healthcare system is designed to produce answers, to produce results, and to help the individual get better. A test that comes back negative saying that there's nothing wrong with you is still a step forward. And I think it's
Exactly.
important for people to understand that.
Yeah, and that's exactly right. And we frame that and say, listen, we might not be able to tell you what you have, but we can do a decent job, depending on what the complaint is, of saying what you don't have.
Yeah.
Some of the bad things that we might be concerned about. Let's see if we can take those off the table, or within reasonable certainty, take them off the table. And in the meantime, make you comfortable, right? Because often we're so focused on finding the answer. It's like we don't address the person's distress or suffering, and they're there for hours, and they go, "Oh, can I get something for the pain? Oh, yeah, you're in pain."
Yeah.
Um, and it's amazing how more understanding people are when you actually make them more comfortable. And so there's a lot of things that go into this. And something you said, John, that I thought was so interesting about, you know, not having an answer, and then somehow, depending upon the situation, making people might think that the doctor doesn't care. And that's so fascinating, right? Because the two don't necessarily, like, you can say that you don't have an answer and still care.
Yeah.
In
Yeah.
fact, the caring comes through the effort of trying to come up with an answer. Um, and so, and the impression I get from many of our patients is that sometimes they get that feeling. It was framed in a way that they just, when you get down to their uneasiness, it was with a previous experience, and hopefully it's not mine, but maybe sometimes is the fact that they got the impression that the doctor didn't care. That's usually it. Not the fact
Yeah.
they didn't have the answer. It's the fact that they got the impression that the doctor didn't care. Either they blew them off, or they didn't let them speak long enough. They weren't going to listen to their problems, or something we haven't talked about. Instead of welcoming and embracing uncertainty and acknowledging it, just giving them a diagnosis that they know is not the right diagnosis, or doesn't feel like it doesn't. They people do their research on Dr. Google or whatever. That I'm not saying that's the place to go, but people go there.
Yep. Yeah.
Um, but whatever reason, they say, "Listen, I don't think it's it. He just gave me this diagnosis." And the problem is that when people do get diagnoses, and it's not the thing, but they try to do it to make patients happy, like someone with a headache, and they just give someone a migraine diagnosis. It stops us from looking, because we say, "Oh, you have this person with a headache, they have a migraine," and they say, "Who diagnosed you a migraine?" "Oh, you know, was it a neurologist? Was it someone with more expertise?" And it might sometimes it's not, and they're going, "Why did they say that?" Because I don't know why they said that. Sometimes it's spoken with a lot of sort of, like, there's a lot of logic there, and you might read a note and you go, "Oh, I see why they say that." And sometimes it's because they're not comfortable with uncertainties. They're giving a diagnosis,
Yeah.
and then that stops the search, or limits the search, unless you really care to look back. I had someone who was labeled with a migraine who ended up having a brain tumor. Um, and so, you have to sort of be open. Sometimes there's a lot of good that comes from maintaining openness in our thinking, right?
Yeah, and it's okay to say I don't know. I think that there's such a stigma in our society about being uncertain or saying that I don't know at this moment in time.
I know.
That we need to fill that void immediately. Otherwise, we're going to be labeled as incompetent or look foolish, or something of that nature, which is ridiculous.
And I don't know doesn't necessarily mean I don't care,
Yes,
right? I mean, you can
correct.
say I don't know, and that uncertainty is coupled with a great amount of compassion and diligence, and it's also hopefully it's associated with what you do know. Like, this is what we do know. You don't have, like, you have belly pain. We know we did a CAT scan. You don't have appendicitis. You don't have an infection that we're seeing, or we don't, your gallbladder is fine, whatever. And so we know this is what we do know, but this
Hmm.
is maybe the steps that you need to take, or the next set of tests that you need. But we started the workup, or the workup, we moved the workup forward. And I feel like that might be what we need to be doing, Don, right? Is just sort of, how do we, when we don't know, how do we both validate a patient's experience or someone's experience and recognize the challenges that they're going through, and then just move things along? Like, we might not have certainty, but maybe we remove certain levels of uncertainty.
Yes. I mean, yeah, and that's just the scientific process. I mean, there is
Right,
no
right,
absolute proof in science. We can't say anything with 100% certainty. What we do is we are less wrong. We take incremental steps towards being less wrong about the situation.
right,
Yeah, or removing uncertainty is another way of saying that. And
right.
that's just how it goes. That's just how it goes. But I don't know if the average person kind of understands that, and they really um, don't like the uncertainty. But I suppose it depends how you frame it, like we talked about earlier. I mean, if you give them a game plan saying, hey, for right now, we're not quite sure, we ruled out all of the really bad things. Here's a game plan moving forward for you.
I also, and I feel like it begins again on that platform of story, like trying to understand, like, through story, we understand a patient's experience. We try to as best we can, and then when we talk to them, when we talk to patients, and we have a conversation with patients and their families, we're usually sharing stories. Like, we say, "Listen, this is what we know. This is what we don't know," and you're telling a story. Um, and maybe this is what patients who have had these situations before, this might be the next steps, is what might be what your doctor might be interested in doing, or and they'll tell us their stories. Well, I don't, you know, my doctor has talked about that. And then you're right. I mean, he said that, and I wasn't comfortable doing that test, but now I think I need to do that test. But they'll come back with other stories. Or my
Yeah.
aunt had this or whatever, and this is what happened to her. And that was, and so really, like, that is, I think that's where, not just where information is exchanged and where insight into one another can be found, but I also think that stories are the platform in which, and where trust is built. And I feel that patients will accept, getting back to your original question on it, I think patients will accept their uncertainty if they trust you.
Yeah. Yeah, I really like what you said there about stories or narratives that's kind of how people talk. And then they use anecdotes. So people are prone to using anecdotes or stories or pulling
Right.
from experience. You talk a little bit about availability bias and other types of biases in medicine, but yeah, people kind of grasp at what they know and then they communicate and talk in stories, um, which is really interesting. I mean, it can lead to all different types of errors in thinking, but yeah,
Absolutely.
that's just what appeals to people. It's just kind of how people are wired, and until they're trained differently, which would have to start pretty young, I would guess. But that's just kind of how we, I would guess, evolved, and then it just over time. I mean, because if you think about it, a long time ago, we didn't have the scientific method. So what did we do? I mean, if we wanted to communicate with people, we would pull things immediately from our
Right.
environment and tell the person
Right.
sitting next to us. How would we pass
Right.
them down from one generation to the next? We
Right.
create stories.
Right. That's
So yeah,
exactly
these
right.
things come to us very naturally. And many things in science, medicine are unnatural in the sense that we kind of have to fight a little bit cognitively to get over these hurdles to start thinking in this manner.
I
But
also want to, you said something that was so interesting about the fact that, stories are not always, there- there's a darker element to stories
yeah.
as well that we know that we haven't really talked about. And it's true, like, because of the power of stories, like, it can beguile us. Like, we can be convinced of a story much a much more engaging and way than sometimes than by the facts. We will believe it's like we will question statistical methods, right? As scientists, we'll read studies and we'll study the methods and discuss the different types of processing and statistical methods used to just to validate and legitimize the data. And we say this is like a legitimate or statistically significant outcome, or a valid study, but we don't necessarily interrogate stories in that same way. We believe a
Yeah.
story because we believe a story because we
Yep.
believe a story.
Yeah.
And our brains, and as I said in a couple of times in the book, is like, we will, our brains are hardwired for story. Many people have written about that, and we don't necessarily, like, we'll just take the information that's available and create a story, and we oftentimes don't necessarily recognize or acknowledge the information that we don't have,
Yeah.
when we create and construct not just stories in our own mind, but we're actually just constructing knowledge too,
Yeah.
in a way. And so we have to be sort of being open and being sensitive to the way narratives operate. Is also being open and sensitive to the way that narratives can beguile us, and to be open and to be aware of that as much as we can. It's hard.
No, yeah, absolutely, 100%. Definitely have to be open to it, even if the story is more readily assimilated than the actual facts.
Exactly.
But anyway, based off of all of your experience, how are you advocating for changes in medicine with like the power of connection, creativity? How do you want to improve medicine? How are you hoping to do that? Because you talk a little bit about that in your book, and I know you're,
Yeah, it's really hard, because medicine is prides itself on being evidence based, and
yeah.
very science using, as it should be, right? I want to get that out there, we're dealing with people's lives, and we should be making decisions based on very sound evidence and research that is built on the experiences of like thousands, about tens of thousands of hundreds of thousands of participants. However, again, in medicine too, we also take care of one patient at a time. And so, we have to be also bring other tools to the clinical encounter. And I feel like we need to be thinking more about how we think.
Hmm.
And I feel like arts-based thinking, like artists, and somewhat in some way scientists as well, like, will document their thinking process, right? I mean, when you create a work of art, when I create a story or create an essay, or is like the final product, like what that's not the intention. The intention is this final thing is the result of my thinking process, of me. That's the final physical manifestation of my mind at work, right? Of thinking through something. And so I feel like we need to focus not just on outcomes in medicine, which is pivotally important, but arts-based questions on, like, that have to do with process. How do we get clinicians to think about how they think, why they're thinking a certain way, and then realize that there are certain elements of what we do which involves and requires creativity, because they don't fit a certain script. Like, they don't follow an algorithm. You'll need to apply the science and apply the research to this particular situation, which is unprecedented.
Hmm.
And I'm 30 years of doing this, and my last two overnight shifts where I just came off of, I've seen things I've never seen before. So we need adaptability. The pandemic if it has taught us anything, is the fact that we got to be adaptable, right? We got to be prepared. We got to be prepared for uncertainty. And I
Yeah.
think that people who are most skilled in learning how to use uncertainty and how to become and thinking through problems, I think are artists and designers, and I think the humanities people, and people who are thinking about critical thinking, people like yourself. So I think the news I've written in the past about, I feel like the new interdisciplinary team in medicine and healthcare has to include, clinicians of all stripes, and all those usual suspects, but also writers and designers and artists, and to help inform that, bring those skills into norm and hopefully normalize uncertainty and how we work through challenging situations.
Hmm. Yeah, I can't think of any sort of life situation that wouldn't benefit from learning how to be a more creative problem solver.
Yeah,
Creativity is such an integral component of solving problems and
right.
confronting situations that are novel, that you've never come across before, and then being able to think quickly and pulling from all of your life experiences, using lateral thinking, using critical thinking, all of these other mental models that you developed over the years. Yeah, yeah, I couldn't agree more. Yeah, I
And
think it's wonderful.
yeah, and divert and like the fact that we're so reductive in
Yeah.
medicine, and that what we're talking about is initially being recognizing when we need to be divergent, and what that means, like not just as a term and as an idea, but how in practical terms we get to that. And I mean, those are all experiences that like what we're talking about. You can write about it, you can talk about it, but you actually people have to experience it, right? Like, you have to play with it, and, like, you have to get dirty with it and then see how you're responding to it, and how your behavior and how you're thinking perhaps differs from your idea about how you should be behaving and how you should be thinking.
No, absolutely. Couldn't agree more. Anyway, Jay, it's been a wonderful conversation. I just want to thank you so much for stopping by. And where can people connect with you? I mean, do you have a website? Do you have social media? And
Yeah,
then,
they can, yeah, I am, sorry to interrupt. I
no,
am,
no, no, go ahead.
on www.jaybaruch.com, Jaybaruch. I have a website, and that you can actually contact me through the website. I'm really poor on social media, but I'm not, I'm struggling, but I'm there. I'm on Twitter, and it's, Jay Baruch, MD at Jay Baruch MD, and I'm on LinkedIn.
Okay.
And for people, if they want to find my book, and I hope they do, it would be a great honor for me if your listeners would take a look at my book. It should be in sort of local independent bookstores, either in your community or online, and it's also available at certain behemoths that we will that we will not name, but it's there as well.
Okay.
And so but it'd be great if people can support their local outlets. That would be great too.
All right, perfect. Anyway, for those of you who are stopping by, thank you so much for joining us. It's been a wonderful conversation. I hope that you enjoyed it too. Please share, hit that like button, and stay tuned for more great content coming your way. Take care.
Thank you.